thank you so much for joining us. My name is Barbara Munoz, and I'm the Program Director with the Utah Academy of Family Physicians. We are a membership organization for family physicians across the state of Utah. And we have about 1,000 family physician members, and we love working with our family doctors. And they have been such an integral part in working with the community on educating patients, educating community members about COVID-19. So we wanted to host this panel tonight and just allow anybody who has questions about COVID-19 to join us. We have physicians joining us, we have politicians joining us, we have people from across the state, and we're very excited to have this conversation. I'm going to go ahead and introduce our moderator for the night, and then we will just go ahead and get going because we have lots of questions to cover. I'm very happy to introduce Ben Winslow. He is Fox 13's reporter on Capitol Hill, covering a wide variety of topics, including politics, polygamy, vice, and courts. He's been in the news business in Utah for more than 20 years now, working in radio, newspaper, television, and digital news. And Ben has actually received numerous honors for his reporting, including a National Edward R. Murrow Award, the Religion News Writers Association Local TV News Report of the Year, the Utah Broadcasters Association and the Society of Professional Journalists. Readers of Salt Lake City Weekly and Q Salt Lake have named him their best news reporter for many years now. So we are very happy to have him join us. Thank you so much, Ben, for joining us.
Well, thank you all very much. And this certainly comes on a very interesting day, the day when the state reports a record-breaking number of cases, 911 new COVID cases across the state. And a lot of people have some really good questions that I want to get to. So I'm going to quickly go through the biographies of our panelists, and then we'll get right to some of these questions that were submitted to us that I think are just things that will help a lot of people. Our panelists include Representative Suzanne Harrison, who is also a physician. Suzanne Harrison, an anesthesiologist at Riverton Hospital. She also represents Sandy, Draper, and White City in the House of Representatives. She is a mom to 3 kids, ages 16, 14, and 12. She completed her residency at Beth Israel Deaconess Hospital, receiving her MD from the University of Utah, completing her undergraduate studies at Stanford. She's the past president of the Salt Lake County Medical Society and past chair of the Department of Anesthesiology at Riverton Hospital. This is not going to be the first time I'm going to, mispronounce a medical term or something like that tonight. I guarantee you. Our next panelist, Dr. Andrew Pavia, is the George and Esther Gross Presidential Professor and Chief of the Division of Pediatric Infectious Disease and an Adjunct Professor of Medicine at the University of Utah. He also serves as the Director of Hospital Epidemiology at Primary Children's Medical Center and Associate Director of the Antimicrobial Stewardship Program. He received his MD from Brown University, was a resident and chief resident in medicine at Dartmouth. He serves as an EIS officer and preventive medicine resident at the CDC, where he worked on diarrheal disease and HIV. He also did pediatric and adult ID fellowship at the University of Utah. His research interests have been wide-ranging, tied together by a focus on emerging infections. Nubia Pena is the director of Utah's Division of Multicultural Affairs, where her mission is to promote an inclusive climate for Utah's growing diverse community through training, outreach, and youth leadership development. Ms. Pena received her Juris Doctorate from the University of Utah's S.J. Quining College of Law back in May 2016. During that year, she was selected as one of 25 law students in the nation to be recognized and highlighted for her social justice activism in the National Jurist, a leading news education. Dr. Jose Rodriguez currently serves as Associate Vice President for Health Equity, Diversity, and Inclusion and is a professor in the Department of Family and Preventive Medicine and Associate Medical Director at the Redwood Health Center. While at the University of Utah, Dr. Rodriguez has taken a strong role in advancing the institutional goals for both health equity, diversity, and inclusion. Within his department, he served on the diversity committee as well as various recruitment committees supporting focused recruitment of underrepresented ethnic and racial minority faculty and residents. He's represented the university presenting at national conferences on our work and his research on diversity initiatives. Dr. Todd Vento is the medical director of telehealth, infectious diseases, and Intermountain Connect specialty care at Intermountain Healthcare. Dr. Vento received his MD from the Uniformed Services University of the Health Sciences and MPH in Epidemiology from the Johns Hopkins University School of Public Health. He completed internal medicine and preventive medicine public health residencies and an infectious diseases fellowship. Dr. Vento has published on a variety of public health, telehealth, and infectious diseases topics, and holds academic appointments at UHS, the University of Texas Health Sciences Center, San Antonio, and University of Utah School of Medicine, where he also co-directs the Global Medicine course. And Dr. Ray Ward, also a representative, has served in the House of Representatives since 2015, representing Bountiful. He focuses his legislative efforts on medical issues to make sure that state Medicaid program runs well and to fight the opioid epidemic. He is a family physician in private practice at Cope Family Medicine Ogden Clinic and enjoys working with Medicare and Medicaid patients. He also treats patients who have difficulties with substance abuse. He has an MD, PhD from the University of Washington, Seattle, and completed his residency training in Grand Junction, Colorado. And he and his wife, Beverly, live in Bountiful and run the Bountiful Math Circle, which gives kids who love math a chance to prepare for math competitions. So we have a wide variety of people on this panel, and let's begin with talking about, especially with what's happened today with a record-breaking number of cases. I want to throw this out to our two elected state lawmakers, Representatives Harrison and Ward. How will it be continuing to be involved in both the health and economic recovery of Utahns from your perspective? Let's start with Representative Harrison.
Well, I think today's case numbers are sobering and should be an additional wake-up call that even though many of us are exhausted and, our patience is wearing thin with this virus, the virus, does what the virus does. And we really need to make sure that we're looking out for each other by doing these basic things that everyone knows what to do: social distancing, washing hands, wearing a mask. And my priority as a state representative is to make sure that the state is supporting everyday families in every community across the state to protect both their physical and their economic health. And there's many resources available to help tackle both of those issues. And they're really not in competition. I see them as together. Like we have to have healthy people in order to have a healthy economy. And I really appreciate the work of so many throughout our state who are working to tackle these things.
Representative Ward.
So I think today's numbers maybe highlight the fact that the state can do certain things, but the way things turn out doesn't really depend just on what the state writes down on a paper or puts on its website. In the end, the way things turn out will depend partially on that, but will depend also on what each of us as individuals choose to do and how we choose to behave. The state, I feel like, has had a quite good response overall, especially compared to other states. The state early on worked very hard to get tests themselves available, to get testing capability here to the state, and did a good job of standing that up. The state has done a good job, I think, of collecting all the information and then putting it back out to where people can see it to make good decisions. It's also important, sometimes when people say the government did something, it's worth saying it's not one government. There's the state government, there's the state school board, there's every individual school board, there's different municipalities, there's all of our different county mental health departments. There's 20 different governments making recommendations and trying to figure out how their own little local piece of the puzzle fits in. And together with all of that, that will interact with the choices that each of us choose to make of how, if we are willing to social distance and wear a mask and be careful and get tested when we have symptoms so that we don't pass it on to someone else, the combined togetherness of all of that is what's going to dictate how this turns out for us.
Director Pena, can you please talk about the Division of Multicultural Affairs' role in combating COVID-19, and as well as where people can find resources in languages, of course, other than English?
Absolutely. Thank you so very much, Ben. So as a brief introduction to our division, we are a state division that's been codified as of 2019. And our task is really to create an inclusive climate. And once the governor issued a declaration of emergency in our state on March 6th, very quickly we recognized that multicultural populations and racially and ethnically diverse populations were going to be affected differently based on pre-existing inequities in healthcare, in access to services, in language accessibility resources. And so what we did is we conducted a survey, and that was the Multicultural COVID-19 Needs Report, to establish a baseline of what communities of color, and specifically communities who may be existing within shadows, so let's say undocumented, mixed status, and families that had been originally and traditionally left out of the relief efforts, what were they living through? What was their experiences and what were the barriers? And we did that in order not only to establish the baseline, but to elevate those concerns to state leadership. One of the recommendations that we made in that report was that there needed to be a dedicated group of individuals that focused specifically on addressing the gaps that the report found. We found that there was language accessibility concerns, there was fear of deportation, there was fear of inability to access healthcare. Where would people go for testing? There was a lot of misunderstanding and misconceptions. So with all of that, we were finding the inability to access media and social media online. There was digital equity and access concerns. So all of those things, we decided in the report to ask and request that there be this group created. And our division was appointed to oversee the COVID-19 Multicultural Subcommittee, which is now the Multicultural Advisory Council of Utah's COVID response. And it is a group of 26 individuals that have been appointed. We have 7 strategy groups that we focus on, addressing food insecurity, housing insecurity, digital equity, economic sustainability, housing and social services. We also talk about language accessibility and ensuring that people also have information to communication outlets. So how are they accessing and consuming through non-traditional forms of media consumption? And it has really been a phenomenal effort to work in partnership with people who not only are from state agencies, but also community nonprofits, faith-based organizations, and community activists and leaders. So this is a very heavy lift. And again, I commend the people who are participating and volunteering their time. And when you talk about resources, one of the things I would invite people to do is to visit our website. We have collected several resources, both national and local, that have been developed in multiple languages. So we have 19 that are highlighted, and we also link out to the Utah Department of Health website. They have done an exceptional job. And again, I really want to highlight Jenny Johnson and Joel Fierro, who work on plain language, as well as Edwin Espinel and the Health Disparities Division. Again, there are a lot of partners that are trying to move the pieces to make sure that families who belong to these communities, their needs are addressed. And so again, if people are interested in the resources, I invite them to explore our website.
And the website address, just so people have it.
Of course, it's the multicultural.utah.gov.
Perfect. And that brings us to these questions that we want to get to that were submitted. And we've got a lot of questions, a lot of really good questions. And so one thing I would ask our panelists, just so we can get to as many questions as possible, please keep your answers as short as you can. But we're going to start with mixed messages on the internet. And this was a question submitted by Mercedes. And we're going to throw this out to Dr. Harrison first. How do I verify news I see on social media? What are the best sources for up-to-date information that's actually easy to understand?
There's a lot of misinformation out there, so much misinformation. I really urge people to go to reputable sources. The CDC has excellent information, cdc.gov. There's also a lot of great information and local resources on coronavirus.utah.gov. All
right. Next question from Kaylee, and I'm going to throw this out to Dr. Pavia. Kaylee writes, I've read a lot about these different vitamins I should be taking, like potassium, vitamin C, vitamin D. Should I be taking these?
Go ahead, unmute. Unfortunately, there's no evidence that there's any vitamins or minerals that are specifically going to help you fight COVID-19 and avoid it. So if you have deficiencies, if you're not having a balanced diet, then vitamins can help replace what you should be getting from your diet, but they're not a magic bullet for any infection.
All right, the next question is from Stephen, and I'm going to give this to Dr. Vento. Does blood type, i.e. type A, increase risk for more serious COVID-19 disease progression?
Yeah, actually, there have been studies that have looked at, and in terms of large populations, particularly in China, where they looked at the number of folks or patients who had infection and didn't have infection to see whether there was an association with having blood type A versus blood type O, et cetera. And they did initially report that it was felt that maybe type A might increase your risk or be associated with an increased risk of infection. It's been not clear whether or not it can increase the severity of infection. There's a thought that it might increase risk of getting the infection, whereas maybe blood type O might be protective. But one thing about those kinds of studies is they don't always go and look at the other factors that are also associated with having those blood types. For example, if more people with blood type A had diabetes or heart disease or hypertension, high blood pressure, and those were the things that were increasing their risk, or maybe their ethnicity, and that those were the factors that were increasing the risk of infection, that it might not be the blood type, it might actually be those conditions. So we're still studying that, but there's a large study that's actually coming out, or actually just been recently published, that does talk about that.
Dr. Rodriguez, this question is for you, submitted by Lynn, who writes, my family thinks I'm paranoid. I still wipe down my groceries, except produce, of course, with Clorox wipes. I haven't taken my dog to the vet because I worry about the virus getting on my dog's fur. I let all my packages from Amazon sit in the garage for 2 to 3 days before bringing them in the house. Is my family right? Is Lynn paranoid?
Well, thank you. What a great question. In the interest of brevity, I will have to say that there's a lot of good things that are being done. You're being very, very careful, and I think that's very important. Do I think you need to wipe down all your food with Clorox? Probably not. Do I think that you need to leave your stuff in the garage for 3 days? Also, probably not. However, the attitude that makes you wash your food and leave your stuff in the garage is actually the correct one to have, because we cannot be too careful. So if I was to say something, I would say stick with the 5. Wear your mask, wash your hands, practice physical distancing, take your meds, and if you need us, come see us either by video or in person, because those 5 things are really the foundation. The other stuff may or may not be helpful. There's been evidence recently that shows that there's not a lot of transmission of COVID from surfaces. That doesn't mean that it's zero. So I think you can step back a little bit and not be as meticulous, but keep the same attitude about being careful. This 900 cases, or almost 1,000 cases actually from today, there's a lot of that has to do with us not doing the 5 things. And we should remember that.
All right, the next question is submitted by Marcus, and it says, if I test positive for COVID-19, does that mean I don't have to worry about getting it again? Dr. Vento, going to throw that to you.
Yeah, it's a really good question. And what we do know is that not everybody makes an antibody to the virus that causes COVID-19 when they get infected with COVID-19. That may not necessarily mean that they will absolutely get infected again, but it means we just don't see that everyone makes an antibody. We do have studies that show that if you have a severe infection, there might be an increased likelihood that you will make an antibody, but what we don't know is whether that means that over time that antibody is the antibody that will prevent you from getting infected again. And I know that's not the answer that everyone wants to hear, and this has been a steep learning curve with this new emerging pathogen or emerging infection. And so what we still say to folks is that if you've gotten infected with COVID-19, we still think that you should take the same exact precautions to avoid getting infected again. You may have some immunity, but we don't know that definitively yet. And we also don't know yet whether making an antibody response from the vaccine will be effective, but we certainly, based on initial studies, think that might be the case. So I would say still take the same exact precautions, do your 5 mitigation measures that Dr. Rodriguez mentioned, and prevent from getting it again, just in case that you don't have that protection.
All right, Lauren writes, how can I best send my children to school safely? Will we ever ramp up testing, such as on a regular basis at schools, to stay open? Representative Ward, Dr. Ward, I'm going to throw this to you.
I think the things that to keep in mind for keeping kids safe at school are the same things that Dr. Rodriguez already mentioned, right? The answer isn't different. Wearing our mask, keeping a distance when at school, being careful to keep our hands washed. Those same things are the answers at school as they are anywhere else. Schools have been the nucleus of a lot of the infections that we're seeing in these last couple of days. And in many cases, that has been even not from the school, but it's been from extracurricular activities and people behaving in an unsafe way when they were not at the school. I don't know if the day will come when we are actually able to provide daily or weekly testing at all of our schools. We have ample testing capacity in the state right now. The guidelines have changed again so that a person can get tested if they want to get tested. And clinics like my clinic and many, many clinics, our normal healthcare system out there is available to do tests when there's a reason to do tests, either for symptoms or for an exposure. Hopefully people are able to get tests very quickly. I mean, we are having less tests done now recently than we were in the past, but we still have that capacity there. So hopefully people will take advantage of it.
Right. Dustin writes, I have kids in school and daycare. They get colds all winter long. Do I need to get my kids and family tested every time they come home with cold symptoms? Dr. Pavia.
So that's a great question. And the answer is a little bit complicated. Kids get mild symptoms as a rule when they get COVID-19. So it's hard to look at any specific symptoms and say, this couldn't possibly be due to SARS-CoV. What we do know is that there's some symptoms which are much more predictive. So if they have a high fever, if they have a cough, if they're short of breath, if they've lost their sense of taste or smell, those are red flag signs that they absolutely should get tested. If they've been exposed, they should get tested. If they have a runny nose with no fever and no other symptoms, it's relatively unlikely that that is SARS-CoV, but we can't say that 100%. My advice is, if in doubt, get tested. But look to the actual symptoms and how sick they are and whether they've been exposed.
Jeff has a really interesting question. Says, my neighbor is a healthcare worker. Although I appreciate all she does, I don't really want my kids playing with her kids right now. Am I being too extreme? Dr. Harrison?
Well, I would be more worried about your kids hanging out with 15 to 24-year-olds right now, which appear to be the super spreaders in our state. So I think it's not necessarily who they're hanging out with, but just making sure you're taking those safety precautions. Doing things outdoors is your friend. Keeping physical distancing is your friend. Finding activities that you can do without, sharing the same, handles or ball or whatever. Going on a hike or something is these things that kind of keep us all safe, but still have that really important social contact that we all need.
Oliver writes, what do we do with young children who can't wear a mask? Is it safe to take them on play dates or to the grocery store? Dr. Pavia?
Well, we've had pretty good luck getting kids down to about 3 to wear masks pretty effectively. It takes some patience and some training, and your pediatrician or your family practitioner probably has some advice to help you with that. The major role of masks is to prevent the person who may have an asymptomatic infection from spreading, so that your child's at only slightly increased risk by not wearing a mask, but you need to use good judgment. Probably you should not take them to a crowded wedding where lots of people are mixing closely. If you're going to an uncrowded store and you're going to maintain physical distance, and you're able to clean your hands and their hands, it may be an acceptable risk.
All right. Irma writes, I am Latina and almost 60. I also have high blood pressure and pre-diabetes. I've not attended many family gatherings, and when I do, I will only join outside. I'm very worried about the holidays and insulting my family if I do not go to dinners and parties. What should I do? Director Pena, let's start with you.
Thank you so much, Ben. So what I appreciate about Irma's question is that there's cultural nuance here. And what she's worried about is, how do I not insult my family? We are trying to push out messaging through our social medias, as well as Univision, Telemundo in partnership, to make sure that we are talking about the risks of having large gatherings and getting together. And we're having Spanish town halls so that people in their language, in their native speaking language, will be able to consume the information, as Dr. Rodriguez said, to try to practice social distancing. So right now, because of the numbers, we're encouraging people to continue to practice safe distancing, to decline those invitations, to let people know that it's not personal, but simply, again, that because they're high risk, because they might be immunocompromised, that they really want to ensure that they don't pose a risk to themselves or others.
Dr. Rodriguez, anything you want to chime in with that?
I just want to say Irma's on the right track here. It is very difficult in our Latino families to actually, we don't know how to show love without hugs and kisses. In fact, in a lot of families, we don't even know how to say hello without doing that. So I've been adopting this air hug thing. Abrazos en el aire, and then next time I'll give you a real hug. My son got married on August 20th, and his grandparents couldn't come. It broke their heart. However, I was the one who said, we love you too much to ask you to come, because the risk is too great. And so as long as we can get the message that the staying away is actually an act of love, we can ask for forgiveness and not worry about the rest of it. But it's not easy. It is culturally difficult.
Virginia says, I'm elderly and have a heart condition. My husband and I are quarantining most of the time. I always get my flu shot. If I am not leaving the house much, should I still get one this year? Dr. Ward.
So I think the answer is yes. And I bet in those times when you're leaving the house, I bet at least one of them's to the grocery store. And the grocery store's got a pharmacy right there with the flu shot. You shouldn't need to make any extra trip to still be able to get that flu shot at one of the places that you already have to go. I want to shift back to just one question. I think it's really important to me to realize that this is not a one-sided equation of saying the only solution here is to limit contact with other people and that will be our best pathway forward. Having some contact still with the people we love is equally important, and terrible things can happen if that just gets cut off in the name of safety. At my clinic here, we have, this is not just my patients, but at my clinic, we have what I would say, there's 3 deaths that were from the virus, but we have 1 death that was suicide. That was, to me, very clearly from the social things being cut off from an elderly gentleman who all the things he valued were cut off from him. And in his state, that was too much. And he killed himself. So this is a balancing act to balance the social input and love that we still need while being as safe as we can with respect to the virus.
Dr. Vento, I'm going to throw this question to you. Chad writes, how safe is it for me to visit my kids or grandkids? I'm having such a hard time emotionally being away from my grandkids.
Yeah, this is probably one of the most difficult questions we get from our patients, especially of our elderly patients in our clinic. What I think it kind of ties into what was just said by Dr. Ward as well is that, obviously, if you have a serious medical condition and are elderly, you have increased, even maybe double or more, the risk for having a severe infection if you were to get an infection. So while you may think that, oh, my children and my grandchildren, they don't have it, they haven't had any symptoms, the reality is we really just don't know. People can have asymptomatic infections, so no symptoms, carry the virus, spread it to others, and then the infection in the person who's older or who has underlying illnesses can have a worse outcome. And so for that reason, I think that would be my first priority, to look at that. That said, the other options are, if you feel like I want to see them because of the concerns of maybe the other things that you have to weigh the risk benefits from social isolation, how that's affecting your mood and your approach to your daily life, then do it in a manner that then maximizes the other measures. And that's an opportunity to educate your family members. So then the grandkids can learn that, oh, grandma's coming, but she's older and she could get more sick. So we're going to all wear our masks. We're going to wash our hands. We're going to stay apart, but we're going to enjoy their company and keep that distance. So if you keep the distance, you're not going to you're going to decrease the risk significantly. So that would be one option. Obviously, the most effective way to prevent would be no exposures. But if you feel that that's something that is more important to you, then just do it with all of those precautions.
Dr. Pavia, this question comes from Stephen, who says, I'm in my late 40s, have type 2 diabetes, I'm overweight, and have had acute sarcoidosis, hopefully I got that right, 10 years ago. My diabetes is well controlled, and I don't have any cardiovascular issues or high blood pressure. I have pretty much been quarantined since March as I work from home, and I'm getting most everything delivered or picked up curbside. I do leave the house to walk the dog in wide open spaces and go for drives, but that's pretty much it. Am I being too extreme?
So I don't think you're being too extreme. There are ways perhaps to expand your circle of things you do, but you're at very high risk. You've got probably 3 risk factors, and that means you're very much more likely to get very sick or even die if you get infected. Being outside is a great thing for your mental health, and what you're doing with the dog is terrific, can expand that. But I think you have to be aware that groups of people indoors are dangerous to you, and that's what you want to limit. If you can spend time with people out of doors, if you can stay distanced, then you can have more social interactions. But you absolutely should not be going to eat indoors at restaurants or being at large family gatherings that involve lots of people inside. That for you would be significantly risky. And you know how difficult that is, but that's the reality.
Teresa writes, do we know why people of color are getting COVID-19 more frequently? Director Pena?
Yes, thank you. So people from some racial and ethnic minority groups disproportionately are represented in essential work settings such as healthcare facilities, farms, factories, grocery stores, and public transportation. So these are essentially the people on the front lines making sure that we are fed, that we are taken care of at the grocery store, that we're able to get food for our families. So due to the pre-existing health inequities that we have seen in our community and our society, due to structural racism, we see that families unfortunately have less access to healthcare. They can't take time off from work. They may not be able to have the same support and protections as other people from high education communities or who have wealth that may not be able to necessarily worry about the same concerns. So there is some income and socioeconomic and cultural concerns that are in play.
Jennifer writes, I do not have health insurance. I am terrified to get sick. I heard that getting a test is free. Is that true? What do I do if I get sick? I could not afford to go to the hospital if it gets really bad. And I'm going to throw this out to our 2 state representatives and physicians, Drs. Ward and Harrison. Dr. Ward, let's start with you.
So at the state testing sites, you can get a test there even if you can't pay for it. The tests there are free. I think that's the minimal worry, right? The large worry is about getting sick from this virus. Really, for a person without insurance, the same as getting any other illness, right? I mean, it's going to be the same difficult situation if your appendix ruptures and you have to go to the hospital. Our safety net is better now that we have our Medicaid expansion in place in the state. But in the end, we still have some holes in that network. We have our federally qualified health clinics in the state. They would be happy to see you. They see patients on a sliding scale so that they can take care of most things there. Even if you have very little money, if you have very little money, then we should be able to get you set up with Medicaid. So there are some options, but our safety net is not perfect yet at all.
Dr. Harrison, anything you'd like to add to that, please?
Just Jennifer, my heart goes out to you. There's so many that are in your same position, and there are resources out there to help connect you with help. I encourage you to check out coronavirus.utah.gov, and also the Utah Health Policy Project has resources to help connect you into options for getting insurance, because really no one should be afraid of getting sick and having that fear of what's going to happen to you and your family. So reach out to connect with those resources.
Let's move on to another topic. This is living life in COVID. Dr. Rodriguez, this is a question for you from Mark, who says, is it safe to go to the doctor? What can I do to protect myself when I have to go?
So thanks, Mark. Yes, it's safe to go to the doctor. And I have to say that again. Yes, it's safe to go to the doctor. We will take the precautions to see you in a way that we're not going to infect you. Now, the important thing here, though, is to remember that, we all have to do our part. The masking and the hand washing and the practicing of the physical distance. All of those are important. But, in our healthcare facilities, we have taken extraordinary precautions to protect our patients and to protect each other. All during this crisis, we have been essential employees. And so we've been at high risk. And, as a person of color and as a Latino, there's the essential employee thing is the real problem with me getting sick because, there's not a lot of protections for employment. However, if we remember that there's two ways to do this, you can come see us in person or you call us and then we can decide if this can be done by video. We can do it safely. I'm convinced that we can do it safely. Well, everywhere. My son had appendicitis. He had it removed during COVID and no COVID. So we can do it.
All right. Vanessa writes, I tested positive for COVID-19 over 2 weeks ago and had a pretty mild case, but I'm still worried about being contagious, especially around my parents. How long am I contagious, and is there any way to tell? Dr. Vento, can you give Vanessa some advice?
I commend Vanessa for asking that question and being concerned about exposing others. So that's the first most important thing that she could even think of. What we know is this. So we know when you get infected that people can test positive for an extended period of time, but it doesn't necessarily mean that virus that we find or the remnants of that virus mean that it's going to infect others. And so there's actually been some nice studies out of Europe and actually some data from our CDC, and the guidance that was shaped by those studies that comes from the Centers for Disease Control actually says that if you've been infected, if you've gone 10 days from having the start of your symptoms and you now are not having fevers for at least 24 hours and your symptoms are better, they don't have to be completely gone, that you're not considered infectious and you can remove yourself from isolation. Now, there's some caveats to that in that if a patient has a weakened immune system, that might be someone who might be considered to be at risk for be more infectious or transmit to others for an extended period of time. So we tend to lengthen that period. But by and large, at 10 days from symptom onset, with those other things being present, that would be considered a time when you wouldn't necessarily be infectious to others. The studies have shown that they can't grow the virus up. They just find remnants of it. It's the genetic material of the virus that we still find. I've had patients that have been positive for 42 days and they're not infecting others. They live with their spouse, but they still have test positive here. So the answer would be 10 days. If you want to be safe and err on the side of caution, then extending that to 14 days would not be unreasonable, which kind of gets back to our 14 days of quarantine, 14 days that our health departments tell folks, hey, 14 days, let's try to keep you from being in contact with others.
Jesse writes, it seems like people are really experiencing COVID fatigue and getting more relaxed with social distancing, mask wearing, etc. Any good ideas to help our friends and neighbors stay focused on this other than increasing cases in the community? Dr. Pavia, any advice for Jesse there on how this seems relevant to all of us, really?
Yeah. Well, Jesse, you're right on the money. I think that one of the drivers of the huge spike we're having is COVID fatigue. There are many other causes. And how do we fight that after we're almost 8 months into this? If you go to a place like New York City where the disease has been very bad and everyone has lost friends, people are still wearing masks 100% of the time. And unfortunately, that's not the way we want to teach people by seeing lots more really bad outcomes. I think we just have to gently continue to remind people that the disease is out there, that our economy depends on getting the disease under control, people being able to stay in high school and have their college classes continue. depends on our getting under control. And if you're not scared of this, you should at least think about your neighbors, your family, your friends, your children, and do what you can to protect them. You know, many young people are pretty invincible. They're not scared of getting sick themselves. They'll go skydiving or, you know, longboarding down my street, which is 14 degrees. But they're often very altruistic, and they'll do the right thing for other people, even if they're willing to take risks for themselves.
Dr. Harrison, Moira writes, what is a safe way to exercise and make sure I don't contract COVID-19? I don't feel safe at the gym with winter and bad air coming. I'm not sure what I'll do to stay in shape.
Well, great question. Again, outdoors is your friend, especially when the air quality is safe. The more you can do in terms of socializing and exercising outdoors, that's a great way to reduce your risk. In terms of when it gets cold or bad air quality, you know, it's just a matter of assessing your own risk, right? The more you do indoors in close contact, especially with a whole bunch of people exercising in the same tiny, you know, fitness class, that's going to dramatically increase your risk. If you can exercise indoors with few people, make sure there's appropriate cleaning being done and that they're using cleaning supplies that are EPA approved, that decreases your risk. What we've done is just buy a set of dumbbells and doing stuff in our basement. It's actually, you know, if you have a set of stairs, that's a great way to get a great lower leg workout. And there's a lot you can do at home with just some dumbbells and some creativity.
This next question comes from Jacob, and this is a question I've certainly wondered myself. Jacob writes, should I be wearing a mask outdoors as well as indoors? And when is it safe to not wear a mask? Dr. Ward?
I don't know to tell an exact answer. I think in general, outdoors, it's much safer, particularly in outdoor situations when we're reasonably far away from other people. I feel safe outdoors, not wearing a mask in any situation unless there's a crowd of folks, and then I would still have my mask on.
For Dr. Vento, Roger writes, will we ever go back to normal? That is, not having to social distance, wear masks, anything like that. Are we ever going to go back to normal, or is this the new normal?
I think this question was for Dr. Pavia, not for Dr. Vento, but I'm being silly. I'm going to pull my crystal ball out. It's a great question, and obviously it gets at, you know, it creates stress and worry, and, you know, when will this end? You know, that we've talked about this already. Several have commented on this, and I think the thought is that, you know, normal, right, is that the idea on having a virus circulate in a population from an epidemiological standpoint, or, you know, risk of infection to community, is that to make those go away, we either have to get everybody immune or get rid of the virus, hopefully both. And the thought would be that the vaccine would be a potential measure for that if it has the level of success, and if the number of people actually were to take it and become immune, then the virus has nowhere to go. So it's really, if you think about viruses, they do well by keeping someone alive and relatively healthy so they can bounce to the next person. But if the next person doesn't accept that virus from immunity, then they don't bounce anywhere. They have nowhere to go. They can't just live. They live in us, and we give it to others at college parties or getting together too close without a mask and things like that. So I think the thought would be that if we can get to a level of high immunity and stop the transmission of the virus, then that many things will go back to normal. That said, I did a lot of pandemic planning and work with countries in Asia, Africa, South America for the military, and I will say, I don't look at that as a cultural response that individuals in those countries know how to handle when a new respiratory virus shows up. They know how to behave because they've seen it. They remember their grandmother was infected. They remember what happened. So when a new one shows up, it doesn't take much for them to remember that, oh, you know, we're not going to increase our crowding. We're going to wear a mask. We're going to wash our hands. And actually, those practices have actually been sustained over time. And so what I would say is that we should now think of that for the future, not just for COVID. Flu season is coming up. We tell people to do the exact same things for the flu that we tell them to do with COVID So now what we're seeing in some countries, in particular Southern Hemisphere, is that because of them using masks, washing their hands, keeping their social distance, the flu numbers in the Southern Hemisphere, where they're winters off from ours, have been better. So I would say, I'm not going to say this is like a great thing. It's a silver lining of sorts to say that if we pay attention to these things, we can stop the transmission of other viruses as well as COVID-19, and also look to things like a successful vaccine being used for a large portion of the population.
Dr. Pavia, do you want to add anything to that?
Yeah, sure. I think that we've been led to believe that a vaccine is going to be a silver bullet, and that on January 15th, we'll start distributing the vaccine and everything is going to be okay. And that's just couldn't be farther from the truth. It's going to take many, many months to produce enough vaccine. And we really have to have people trust the vaccine and to go ahead and get it. So I think it's going to take probably until next summer until we see the disease start to fade to low levels. But what we don't know is, will we ever really get rid of it? And as a virologist and somebody who studies epidemics, my guess is that this will join flu as a recurring problem that we have to face for many years to come. We should be able to go back to a lot more of our normal life, but I don't think we're going to ever in our lifetime be able to say goodbye to the SARS virus.
Let's move on to another area of topics here, which is the latest developments and the possibility of a vaccine. This question for Dr. Ward from Karen: are there other tests besides the nasal swab? I heard there's a rapid test, and is that reliable?
So yes, there's a rapid test. It's an antigen test instead of amplifying the RNA of the virus up. It takes about a half an hour to get that result back. That's a test that we run at my clinic. So we did 2 of those today. As a clinic as a whole, we do 20 of them a day. And it is 85% as sensitive as the PCR test. So for 100 patients that the more sensitive test picks up, the antigen test will pick up 85 of them. That's pretty good. The PCR test, as we've said, sometimes is a little too sensitive. Sometimes it'll pick up little fragments of dead virus in there and show positive even when the person's immune system has fought it off. So it's you have to have a little more virus there to find it, but if there is more virus, which most people have, it'll find it just fine. Sadly, Karen, that is still a nasal swab. There are some other tests coming out that are just on a cheek swab, and those are coming new to the market, and those are similar in nature.
All right, this next question. Oh, I'm sorry. Did someone want to chime in?
What I'd like to add to that is that saliva is turning out to be a pretty good specimen. So at the hospitals that use ARUP, we're already using saliva as a preferred test method, and Intermountain's going to be starting that soon. It's not just a question of a cheek swab. You have to produce a cc of spit, which is a fair bit of spitting, but it is painless.
Certainly a lot better than a nasal swab, as some of us who've had those done before can attest. Dr. Rodriguez, Tammy asks, are you starting to see patients that are considered long haulers? And what ideas do you think are helpful for them? Can you start by explaining what a long hauler is and then going from there?
So I have to admit that I'm not sure what they are referring to as a long hauler. If these are people who are sick for a long time, yes, we do see people that take a longer time to recover completely from COVID infection. And for some of them, what has been required is that they take more time off from work. For others, they have been actually asked to go back to work with limited schedules. And still for others, there are some people who have gotten the disease and have recovered, but still don't feel confident that they can actually do what they used to do. And so those people we would invite to come in, talk to us either by video or in person, and to figure out what is a good path forward for them. In my practice, I haven't seen a lot of long haulers, if that's what the question is referring to. But there are people who have protracted illness that aren't better in 10 days, and they feel sick for sometimes 4 to 6 weeks.
Dr. Harrison, anything you want to add about this idea of long-term patients?
No, I think Dr. Rodriguez covered it well.
All right. You know,
Ben,
this
I
is
was
a
just going to
question.
make one comment. So
Please
the
go
long
ahead.
hauler concept of this, it's kind of what folks, it's a term that maybe not everyone is actually using, but we are seeing these patients who have what we call myalgic encephalomyelitis, and fancy word for what is similar to what was described previously as chronic fatigue syndrome. And so we're starting to see with patients who've been in the hospital, for example, that when we do follow up with them, that they actually still have symptoms where they feel like they have muscle aches, they feel like they are just run over by a truck, and it's lasting for weeks to months. And that's actually what people are getting at for long hauler. And there are actually some support groups online that you can go to where patients have shared their symptoms and now realize, oh, wait a minute, I'm not alone. This is not me being crazy. This is a real entity. And for example, at Intermountain Healthcare, one of our pulmonologists who saw patients in the hospital in the ICU with COVID-19 infection was seeing them as outpatients in clinic after they got out of the hospital and recovered from their virus. But after a month, 2 months, we're still having those kinds of symptoms. So I would say there's actually online resources at the hospital systems. The CDC probably has some advice on that too. It was mentioned earlier, the cdc.gov. But there's several online sites that actually I think people can go to look up long hauler, or post-COVID syndrome is another term that you'll hear it called.
And that is the next question that Darren does pose here in these submitted questions to us. And I do want to throw this out to Dr. Pavia and Dr. Vento. Does everyone who gets COVID-19 get long-term effects, permanent damage, increased risk of blood clots, heart disease, lung issues, etc.?
No, so we don't think so. So, there's a lot of people who never develop symptoms, and most of them have absolutely no damage. There are many people of mild to moderate illness who recover fully. And even some of the people who are sicker seem to do pretty well. But there are a subset of people who have long-term injuries. And some of the worst ones are blood clots to the lungs, stroke. One of the things that is being described now that we're very concerned about, but we don't have as much information as we'd like, is heart muscle damage that's being seen particularly in young athletes who have not had terribly severe disease. These aren't people who spend a month in the ICU. It's not something that happens to everyone, but we don't have any way of predicting who's going to have that. So when you think about the college students going out there and getting infected because they're going to be okay, some of them may actually suffer some heart damage that may end their ability to exercise hard or cut short their athletic career.
I want to throw out this question before we start to wrap up here. And this came in during this discussion, which I'm just going to throw it out to anybody who wants to answer it, all of our wonderful panelists here. This is from Jessica, who writes, is there any data regarding how COVID-19 impacts children with pre-existing conditions?
Well, I guess as the pediatric infectious disease doctor, that's probably mine. So yes, kids with pre-existing conditions are more likely to get sick and to be hospitalized. Among the 121 kids that we know have died of COVID-19 so far, about a third have had serious pre-existing conditions like multiple birth defects or neurologic injury. One group that kind of stands out, and we've seen a number of kids hospitalized, are those with Down syndrome, trisomy 21. They seem to have a lot of trouble with the virus. That said, the risk for a kid with a pre-existing condition like diabetes or congenital problems is much less than it is for a 45-year-old with obesity, hypertension, diabetes. But I want people to understand that while kids don't get sick as often as adults, it's not completely benign for kids, and we need to protect them from getting infected as well.
This last question before we wrap up, this one is from Wendy, and I'm going to throw this out to Drs. Vento and Pavia, who says, how optimistic are you about a COVID vaccine safety, effectiveness, and about timing, how many will actually get it?
Yeah, I think right now we have several different types of vaccines that have been studied and are in different stages of vaccine development. that process, and I'm sure many have heard this and seen it on the news, and there's even some, unfortunately, political twisting on the, like, when the vaccine is coming, et cetera. And the reality is it's a very detailed, comprehensive process. And I will say that so far, for developing a new vaccine to a brand new virus that we've just learned about in December 2019, it's actually been impressively quick in terms of what information we've had. So we've done early studies on safety, early studies on effectiveness or efficacy. So essentially, does the vaccine have the patient make antibodies? And that those numbers look really good. The safety numbers look really good. And now we've transitioned into larger studies where we give it to a much larger group of patients to see how it operates more in the real world. And those numbers look pretty good too. So to answer the question, I have optimism based on what data has been presented on the different vaccine candidates so far, based on them making a response and not having a significant amount of adverse effects. Now, the data is not completely out, and that's why we have to be really cautious. And instead of saying, ready to go, let's go, give it to everyone, and then find out later that there's something else that we weren't aware of. And I'll turn it over to Dr. Pavia for more comments on that.
Yeah, sure. And I just gave grand rounds on this subject, so I'll try and keep it short. I think that we have some promising vaccine candidates that are fairly far along in their development. But with vaccine development, you really need to look very carefully at the end results of the studies. So we're rushing the enrollment to get people on the studies, but we can't rush the analysis of the safety and efficacy data. But if these three either don't work or turn out to be less than as effective than one or have too many side effects, there are actually 180 candidates out there. And there's some very promising ones back on the bench that will have every chance of being better than the first round. So I'm very optimistic that we'll get there. I'm absolutely certain we can't have anything out on November 1st with reasonable safety data. But I'm reasonably confident that our first good look, they'll give us answers. It's going to happen sometime between January and March. The answer may not be that everything is working perfectly, but by then we should have a pretty good idea of whether we're ready to go with the first generation of vaccines.
All right, we have only a couple of minutes left, and I'm going to round robin this, so I want really quick lightning round answers from each one of you. And I just want to ask, do you have any advice for people out there as we continue to navigate COVID? Any advice you'd like to give them? And let's start with Dr. Harrison.
One of the things I love about Utah is that we look out for each other and we truly love our neighbor. And even though we're all worn out, we all have COVID fatigue to one degree or another. I have neighbors who've lost loved ones to this disease, and now is the time to really dig deep and show your love for your neighbor by doing these relatively simple steps. Find ways to still stay socially connected, but do it in a safe way, and it will save lives. And get the politics out of this. Listen to your family doctor, and we'll get through this together.
Dr. Pavia, any last minute words of advice?
It's hard to add to what Suzanne said, which was beautiful. I think hang in there. We've gotten through worse before. Our parents went through World War II and migrated, dealt with plagues. We can do it. We're strong. And trust the science, trust the social support groups, and watch out for the more toxic side of politics.
Director Pena, any advice you have?
I would ask that people remain compassionate with our communities that are from low socioeconomic and backgrounds where they don't have the privilege to work from home, where they might not have access to computers, and where there are just a lot of barriers to keep their own loved ones safe. So when you're engaging with those on the front lines, with those at grocery stores or in hospitals or in areas of transportation, be kind to them. They're having to navigate a lot of things just as we are, but with additional hurdles. So again, engage the world in your community with a lot of love, a lot of compassion, and a lot of grace.
Dr. Rodriguez, advice you have for people?
Just to remember that COVID is a time for kindness, and we need to be kind to the people who need. And so sometimes that's the people who are working in jobs that are not protected. We protect them. Sometimes that's the people who are renting rooms at universities. We make sure that their rents are protected and that they can actually do the things that they need to do in this time that they can't work. So just COVID is for kindness, and kindness is masking and washing your hands and keeping 6 feet away and showing love with the air hug.
Dr. Vento.
Okay, I would say this. We didn't know what the term COVID-19 or SARS-CoV-2 was. It didn't exist in December of 2019. And so think about what we've done from December 2019 until now and what we do know. Unfortunately, I understand that people want answers right away, and we made some, stumbling efforts in the beginning because we're still learning. So when we now learn what actually works, and we now know this, we know that these, even though people think it's not sexy, they want a magic pill or a magic vaccine. The reality is those things that we have said over and over again work, and we now know that through data. And so even if someone had told you one thing 4 months ago, that doesn't mean that you don't listen to them now when they say something else, because they've learned. And so I would say trust what science and public health is telling you about what works and what will protect you and save lives, because they will. And try to forget the fact that they didn't know before. But remember, if this had occurred, say, 70 years ago, we wouldn't have figured this out for years, if that. But we figured out these things over time. And I know people want to have those answers up front, but it's what happened, and we now need to adjust. So anyone who doesn't believe the science, really, I would say friends of theirs, relatives of theirs, preach that to them, educate them, because it's for everyone's benefit.
And Dr. Ward, you get the last word.
Thank you. I think the best answer is a balance. We need to take care of ourselves. We need some basic social interactions, or we cannot go on as humanity. We need to take care of our family, and that requires some social interaction too. And we're seeking for the way to do those basic things that our soul needs while being as safe as we can for ourselves and those around us.
All right. Thank you all very much. Wonderful advice for everyone. And thanks everybody for tuning in to this Ask Me Anything. Have a good evening.